If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? Jermaine, Dr. Kyle. Welcome back to the Driven Athlete Podcast. We got Nicole and Joe with us, owners of R3 Health and MedHouse here in West Palm Beach. They're super busy, so I'm super glad that y'all can come in here and shed some light and insights on what y'all do and then how we can help people in the community.
Thanks for having us.
Yeah, we're so glad to be here.
We haven't had you guys at the same time, I don't think.
Yeah,
No.
not many people get us anyways, other than our kids.
This is a rarity, guys.
Yeah.
So save this one. Well, yeah, thanks for coming again. So tell us, guys, like where you're located and then what MedHouse and R3 Health, like what that is.
We're located downtown West Palm Beach on the corner of Belvedere and Dixie. We're in a freestanding building right there, and that's where MedHouse and R3 Health are.
Yeah.
Cool.
Yeah. And so I guess the simplest way to kind of say what we do, who we are, is so we're an integrative and regenerative medicine practice. And so basically what we do is we help people understand how their bodies are aging, why their bodies are aging, and then help put together individualized programs to slow aging down and reverse it. So, we're kind of a really cool, unique health care facility in the sense that we do medicine. So I think one of the things that we don't love is when people think of us as like a med spa.
Oh,
we're not a med spa. We hate that.
Okay.
So we're a really unique situation because we really blend medicine with a lot of the longevity tools that are out now. And, you go to Instagram and you see all these like cold plunge sauna places popping up. So we have all that stuff kind of on the longevity side, but we're really rooted in kind of the foundation is the medical side of what we do.
Gotcha. So MedHouse being the regenerative, the therapies, the modalities for...
We wanted to bring all the biohacking tools in one facility because when we were just a medical practice, me and Joe were sending people out to go everywhere.
You do all that stuff,
Yeah. So one day we were like, why don't we have all this? Like, why don't we create a world?
Just keep it in-house.
Yeah, keep it in-house.
And then that's driven by R3 Health medical side for driving directional care for patients.
Yeah.
That's where we all started.
Yeah, exactly. And again, we're medicine, right? So we're not like an IV clinic where you just go get a hangover bag. We're rooted in medicine, which I'm sure we're going to get into today. But really, that's the foundation of everything. So that way we can put together, individualized programs for people and everything from, which I'm sure we'll talk about, but nutrition and supplements and hormone balancing therapies and peptides and IVs and all the things.
Yeah, no, totally.
Yeah.
Regenerative medicine. What do y'all do for that?
A lot of different things. So I think it just depends on what you're considering regenerative medicine, right? Some people think of regenerative medicine as, longevity IVs, peptides like epitalon or ozone or methylene blue. Some people look at regenerative medicine more so with things like stem cells and exosomes and NAD and stuff like that. We kind of do it all. So it really just ultimately, we want to look at everyone's individual goals and help them kind of get to the place that they want to be.
We have so many people come in at so many different stages. We'll have the person who is pretty healthy and they just want to really optimize, which I'm sure you'll dive into later. And we have the people who their life is a mess. They've gone to every doctor, every specialty. They've tried, acupuncture. They've done everything, and their life is just not making sense. They still have the same problems. So again, like he said, regenerative is very different for
different people.
Yeah, and what they're coming in for.
So let's dive into that. So what do people, because I've heard that story a bunch too, from like a pain, like a neuromusculoskeletal pain. Hey, my back still hurts or my shoulders still bother me. I can't play tennis or exercise like I want to. Nothing's worked. MRIs, imaging's negative. I've gone to every specialist. You're my last hope. For you guys, what is that? And what do you typically see?
Yeah. So, again, in that situation, we're looking for underlying contributors as to why is this patient not healing, right? I had a patient the other day who, was not healing, had a nagging knee injury, right? Imaging was not really impressive. They just couldn't figure out why this guy wasn't getting better. He had, again, we'll talk about this, I'm sure, but like really high cortisol levels, really high inflammatory markers. He was nutrient deficient, right? And this is like a 32-year-old healthy guy. So like even the young ones, we still cannot slow down that healing process if our body is not supported the right way.
Sometimes more the young ones. I feel like the old ones, like they'll truck through anything.
It's kind of true.
Yeah.
The young ones ultimately think that they're like, superhuman and like nothing phases them, or I'm young and healthy and super fit, but like, so I have to be, strong and healthy, but they're sometimes the worst ones.
Yeah.
Is it like an expectation thing? Like I shouldn't be feeling what I'm feeling, comparison on social media, I would assume, or as in like, I'll heal up tomorrow. Like I'll be fine. And that doesn't go away.
Or they just think of it as an isolated, like my knee hurts, rather than like, let's look at the whole picture of what's going on with you and contributing.
I see. I got you.
Yeah.
So with the young patients like that, like what do you do? What would you recommend for that guy?
So that's a person who needs like a good kind of thorough workup, right? They need to get some blood work done, evaluate kind of where their body is like as a whole, nutrients, inflammation, hormones. We had a patient the other day, same type of scenario, just migratory joint pain, knees, shoulders, hips, feeling run down, sluggish, like doctors couldn't find anything. She came in, ended up doing an advanced panel. She had chronic Lyme.
Wow.
And this is a Floridian who doesn't really travel, Lyme.
Wow.
So like, again, without kind of digging in and really looking at the body whole picture, sometimes you kind of miss the underlying issue.
Yeah.
Mold. We see people with all these, we're in Florida, mold, like it's linked to so many different things that go on in their body.
So from a message that I've heard, a theme from you guys and other practitioners are similar. It's like nutritional set things that are holding people back that don't know otherwise, that it kind of may be contributing to limiting their healing potential, and in chronic inflammatory responses in their body that's then proliferating the vulnerable areas to just not get better and expose pain. And then environmental toxins like mold or pesticides, like just environmentally in the air, all those things kind of contributing together. And then the last thing that I've heard, I remember you said too, like with cortisol would be like, stress, anxiety, the mental health component, where it's like all those golden BBs that all add up when it's like all those things combined is the problem, versus like, oh, there's the magical pill, or like that's the magic image that's exposing the problem. It's like, actually it's everything.
Yeah.
So what do you, with chronic Lyme, tell people about chronic Lyme disease.
So chronic Lyme is a really kind of nasty bug, to be honest. And again, even when you're not you don't necessarily live or reside in like a Lyme area, right? People think about Lyme's disease as like a Northeast thing, right? Or a Midwest thing. But Lyme's, is kind of this umbrella where there's these tick-borne illnesses, right? And so we have ticks down here. So chronic Lyme oftentimes goes undetected because we don't think about it in this part of the country. But Lyme's disease, if it's not detected originally, can really turn into a chronic condition where it really affects your musculoskeletal system and your neurologic system. So this patient that I'm referencing had these chronic, on and off joint issues and musculoskeletal issues, and saw, immediate thought is, okay, let's go see the orthopedic, right? Orthopedic says, okay, well, everything looks fine, so I don't know what to tell you. Primary says, okay, your basic blood work looks fine. I don't see any issues. I don't know what to tell you. And then, so, again, we look at the symptoms. We look at, okay, this has been ruled out. This has been ruled out. We got to think outside the box a little bit. And that's how, this presents. But chronic Lyme can really affect your musculoskeletal system and your neurologic system big time.
What do you do for it?
Tons of different ways that you can approach it. We do a lot of ozone in particular for chronic Lyme. A lot of times you can do other kind of biologic goods, like we'll do low dose ivermectin. We do a lot of ozone. We do a lot of glutathione. We sometimes do binders, and then just really supporting the body as a whole, like keeping the immune system strong. We love doing hyperbaric oxygen. Lots of really cool stuff that we can ultimately throw at Lyme. It just really depends on how severe, how long it's been in place. Are there co-infections with other tick-borne illnesses? But yeah, it can be treated very successfully, even if you present, kind of in a chronic timeline.
Explain ozone therapy.
Ozone. So ozone is great. Ozone is essentially the process where, so you can do ozone a couple different ways. You can do ozone for IV purposes, which is where we actually take out your whole blood. And then what we do is we combine your whole blood with the ozone gas. So think of ozone, the air that we breathe is oxygen 2. It's got 2 oxygen molecules. Ozone is O3. So by adding an extra oxygen molecule, it actually changes the way that it works in the body. And it has a very strong affinity to connect and bind with our red blood cell. So we combine the ozone gas with your whole blood. That ozone then diffuses into your red blood cell, hyperoxygenates that red blood cell, and then we transfuse that hyperoxygenated red blood cell back into you. And oxygen basically is the strongest antimicrobial. So it kills everything. It's why you were hearing a lot about in COVID, where they were using the ozone things to clean the planes, and it kills everything.
Makes it an environment that they can't survive in.
Yeah.
Correct. And so ozone is a great tool to get rid of the very difficult spirochetes of Lyme's disease, which is why we have a lot of success with it.
Interesting. And then you mentioned mold. That would just come from, I would imagine like inhaling or just being in an environment where mold unknowingly detected is in the environment and it's just harbored and built. How does that come about? Like, how does that present?
Yeah. So even just here being in Florida, like you were saying earlier, the environment,
One's house,
the humidity and the moisture, just being exposed to stuff like that, where mold is more vulnerable to be present and growing. And again, it has nothing to do with hygiene. I think there's this misconception of everyone thinks about mold as being like,
we're in Florida,
right? It's just a product of the environment, humidity, moisture, dryness. And so mold is a very common thing. So it's either from an environmental exposure, or the second reason that mold can overpopulate or take over our body is that our immune system, our natural defense to combat it or fight, is weakened. So it can be one or both of those scenarios. You know, we get exposed to mold all the time. You wouldn't even know it through products. Think about like coffee beans and things that get imported from these, moist, shipping containers and stuff like that. But a lot of times our immune system will defend and fight it off so that it doesn't overgrow and start to affect our body. So the mold can either be from just like a chronic exposure that's overtaken, or because possibly your immune system hasn't been able to defend appropriately.
Yeah.
Which would explain, you see like a couple, they live in the same house and one person is all these symptoms and the other person's just fine.
Yeah. So it's interesting is like, you would have to dive into like, all right, they have this mold. It seems like they're harboring mold causing these symptoms. We have to investigate like, it's the immune system's compromised. We have to fix the immune system problem. And then of course, like if there's legit mold, like in the house, like get rid of that. Or if there's a substance that's produced, like that's proliferating the mold to begin with.
Yeah.
Well, what, like with mold harboring, does it just find areas to harbor in the body that are the most vulnerable? Like what's it do?
Essentially, yeah. So mold is a very interesting kind of pathogen where
it's sneaky.
It's very sneaky. We know that it actually likes to live in certain parts of our body, like our joints. Yeah. It can get past the blood-brain barrier, so it can really affect our cognition and our neurologic system. But it ultimately just puts more stress on the body as a whole. And so it really then starts to kind of accelerate a lot of those age-related changes in some of those organ systems, but it can be difficult. Really difficult. And again, it's one of those things that typically is not found. So people live with this chronic overinfestation of mold throughout their body, and that's why it progresses, and that's where it can be very difficult to treat. And people see as kind of long-term or moderate to severe mold exposure. It's
hard to find too. Like,
it is hard to
find.
find.
People think it's like voodoo-y and like, like, oh, they're just like, they think what we do is crazy. Like, oh, they don't have mold. Like, how are you going to find it?
I had one patient who we actually found out the exposure was coming from her car.
Interesting.
It wasn't even the house. It was a car.
Wow.
It was a snowbird. She left the car here over the summer. It sat not being run, and the heat, humidity, moisture, and it just, it was coming from the car.
Two questions. How do you detect it in somebody? And then it was like, oh, positive test right here, mold. And then how'd you find out it was a car?
So by process of elimination, that patient had the mold, had the house tested. She had, the backyard tested. We did, all kinds of environmental exposure tests. And ultimately she's like, I feel worse when I'm in the car. And as crazy as that sounds, she's like, okay, we got to test the car.
Yeah.
It was the car.
Wow. Interesting. And then how do you treat it?
So it's kind of a throw the kitchen sink at it. You know, mold develops what are called spores, and spores are like cockroaches. They're like impossible to kill. So again, you go to things like ozone, you go to things like chelation, you go to things like supporting just the innate immune system, just doing what you can to really help the body as a whole.
Interesting. So how is she feeling now?
So much better.
So like you started introducing these therapies, and then after a week, 2 weeks, a month.
It takes a little bit.
Yeah, it takes some time. Definitely mold. Because again, most people with mold will present in that very like severe case because it's been so long.
Yeah, symptoms wise, like how did this lethargic?
Oh, like foggy, like they're living in a cloud.
Yeah, it's really the brain fog, the memory, the recall. It's fatigue. It's random skin stuff.
Allergies.
It's very like non-specific symptoms, which is why it's very hard to kind of put the puzzle pieces together.
Interesting. So then after a couple of weeks of doing this stuff, she's more clear. The clarity's better.
Yeah, I think once the fog comes up, you're like, oh.
Interesting.
Yeah.
Yeah, it's incredible how you know, it can get so bad for some people.
Yeah.
I think also, especially like even just in their heads, like when you're living like this and you can't get any answers, you're like, you start thinking you're going crazy.
Yeah.
So I think just to get some solution, it also kind of calms them down.
No, someone that's probably like
100%.
You're not alone, or like we've seen this. Like
we believe you. You're seen and you're heard. I think that's a big part about what you do too with patients. Like they go to doctors and their doctors think they're crazy.
Yeah, like nothing's on this list. Like
you're not checking any of the boxes. Sorry. You're fine.
Yeah, it's all in your head. Like oh gosh,
it literally is in their head.
So I assume she got her car detailed. Then
so got rid of the car.
She got a new car.
Didn't want anything to do with
divorce the car.
Yeah, that's probably a good choice.
Yeah.
Wow.
Nothing to do with the car.
That's crazy. Well, good. You know, good. She's feeling better.
Yeah.
And what about? I've also heard that. So ozone therapy. I mean, I've heard before. It's effective for a lot of things. Stem cell therapy, like IV stem cell therapy. Do y'all do that too? Like, what do y'all recommend?
That's like Joe's thing.
Yeah,
like what he does.
We really, really have a lot of clinical experience and background in the stem cell space. So again, I think there's this huge misconception about stem cell therapy and how it's illegal or you have to go outside of the country, and that's just false. It's never been the case, ever. And I'm talking 30 plus years of stem cell applications here. So we do all aspects of stem cell. We do stem cell that's called autologous, where we actually harvest your body's own stem cells. And then we do what's called allogeneic, which is what more people are familiar with, which are these, donor, human cell tissue products, right? So the umbilical cord derived stem cells, and we do it all.
And where do those come from?
So the allogeneic, the umbilical cord derived cells, they come from FDA-registered tissue banks, where there's a very
that's where they should come from.
Right. Yes. Everything is. And because we use an FDA-registered tissue bank, there's a very strict process that is from the donation process and the screening of that donor through the collection of the umbilical cord to the processing of that umbilical cord, and then ultimately the preservation and the distribution of the umbilical cord derived stem cells. So it's a very, very by the book, regulated, intense process.
Yeah.
And so again, there's a lot of bad information out there, but these donor stem cell tissue products, they don't contain any DNA. Okay, so all of the DNA is removed. So again, people think about, these cells are going to be rejected by my body or it's going to cause harm. Impossible. Can't. And they go through a very rigorous screening and auditing process to make sure that there's no bacterial overgrowth, to make sure that there's no infection, diseases in these cells. It goes through an extremely well vetted safety protocol.
I think that just paints a picture too. It's super important to make sure that if people are seeking out stem cell therapy, like, I got it online, Amazon or something like that.
No.
There's a lot of potential things that have to rule out is that they're safe.
Yeah. Also people just saying like this product has stem cells in it or this product has exosomes in it. And it's like, where? And it ends up being like, a plant or something.
Yeah. And that does happen.
Or
right?
people present PRP like it's stem cells. We've seen that a lot.
We have seen that a lot. Yes.
I've heard with PRP, you can talk about that a little bit, but I've heard it's okay, but definitely inferior to the benefits and effect of stem cells.
No question, because the difference with PRP is we're only at the advantage of that individual, right? So if we've got a 55-year-old person who's maybe not the healthiest, right? Or pre-diabetic or has a lot of chronic inflammation, their PRP is only going to be as healthy as those platelets are, because we're taking them from that individual. Something like stem cell, especially with the donor cells, we don't have any of that disease process that's taken place. So the opportunity for regeneration is significantly higher. The simplest way to think about it is think about something like PRP as like a fertilizer, right? Where PRP and our platelets have thousands of different growth factors. Whereas if you look at something like a stem cell, it's almost like the seed, right? Something that's being implanted into the body that has that regrowth potential. Whereas that PRP is more of the fertilizer to the body.
Interesting. Yeah. So they are harvested from these tissue banks, heavily FDA regulated. Where does all it's illegal, it's going out of the country, it's like rejected by the FDA in the past. Like, where does that come from?
I think the biggest reason it comes is, they're not FDA approved procedures. And I think that's the stigma that people have a hard time getting.
So the procedures themselves are not approved.
Correct. But there's also surgical procedures that are done in hospitals that are not FDA approved.
Really? Like what?
Well, some of this more of like elective stuff, right? Or like a technique. So, there's arthroscopic procedures that are not technically FDA approved because it goes against kind of what's been true and tested. So there's plenty of surgical procedures that are not FDA approved.
So then that blanket just gets put over and like the whole thing is not FDA approved.
Correct.
I think there's also clinics that have not done appropriate things.
Yeah.
Which have given people who do the right things a bad name.
Oh, 100%. I mean, I would imagine.
We've dealt with that with people we've known and worked with. We've seen them do not great practices.
Yeah.
What would those not great practices be?
Well, so when we're talking about in particular these donor-based stem cells, so there are labs that don't follow these regulatory guidelines. So there is a difference, right? And not all, human cell tissue or umbilical cord stem cells are created equal. And so there are clinics out there that can get these umbilical cord stem cells that have not gone through the invasive regulatory
vetting
processes. And so, there are clinics that can cut corners and get, a lower cost of good donor tissue. And it ends up not being great. Yeah. And we've seen some, unfortunately, big problems.
Or they inject it in like crazy areas that haven't, like orthopedics, that's what Joe does. And it's been going on for a very long time. People know what to expect. They know the results, as where other people will just inject it just anywhere where you probably shouldn't.
Yeah. And I think that's kind of an important point because, again, people look at stem cells as like the magic therapy, right? I mean, stem cells are not going to work if you're unhealthy and we're not supporting your body. So even before we even talk about doing stem cell, we're still going to do blood work. We're still going to make sure that everything is looking good because, again, it goes back to, a farmer doesn't go plant a seed into bad soil, right? I'm not going to go stick stem cells into somebody who's chronically inflamed, diabetic, smokes, nutrient depleted.
Joe's biggest thing is getting people to stop smoking before they come in.
It's like we're set up to fail if we're going to do that.
Totally.
Right. So a lot of clinics don't do that. And they'll offer you a stem cell or exosome IV, but
they won't follow through either.
Yeah. You're just not going to have the outcome because they're not putting it in the right environment to have success to begin with.
That's a good point.
Yeah.
So one more question I was going to ask is how do they remove the DNA from the cells?
So the way that an umbilical cord is collected under a scheduled C-section where both the mom and the donor are extensively screened the whole pregnancy. So the umbilical cord is collected from a special collection institution. And then what happens is that cord gets transported to the FDA tissue bank. And then what they do at the tissue bank is they, for lack of a better word, chop it up. And what they do is they isolate a section of the umbilical cord called the chorion. The chorion is where all of our DNA and genetic material lives. And so what they do is they remove the chorion from the umbilical cord, and that's what strips the DNA material out.
Interesting. And then everything left is undifferentiated
it's like unidentified cells, right?
Correct. Yeah. Cool. Think of it as just blank canvas stem cell with no DNA.
That's awesome.
Yeah.
So other than saying like, hey, a farmer's not going to plant a seed in bad soil. Hey, we need to like clean up lifestyle stuff first to give the stem cell therapy a chance to be successful in a successful environment? Other than that, what would make you say like you're not a candidate? Like not good for you?
Honestly, very, very few things. I mean, we generally, from a liability perspective, we generally don't like to treat, women who are pregnant, women who are breastfeeding. Again, it's more to do from just a liability perspective more than anything else.
Gotcha.
If my wife was pregnant and she had an injury, I would inject her with stem cells. Like I wouldn't have any hesitation, but it's really just more from a liability perspective.
Yeah.
But I would say pregnancy, breastfeeding, people who are being treated for active infections or who are currently active on antibiotics or steroids or anything else from a kind of infectious disease process. There's a couple of genetic diseases that we generally don't like to treat patients with, but very few and far between.
Case by case too. You really look at their whole picture.
We do. Yeah, we do.
What about cancer?
It's a good question. So again, kind of cancer is one of those scenarios where very case by case basis, we generally don't treat active cancer. However, what we will do is we will have that kind of pro and con conversation with someone, right? Because for us, it is also about one of our always objectives is improving quality of life.
Yeah.
Clearly, when someone's being treated for certain cancers, it's a huge influencer of their quality of life. Yeah. And so sometimes we have that discussion and we'll say, listen, these are the hypothetical risks. These are the hypothetical pros. Do we think it makes sense?
Also, if they're on treatment while they're on different things play into it.
It does. Yeah. So cancer's a very individual case by case basis. I wouldn't say no, but I wouldn't say yes.
Like not immediate yes, not immediate no.
Right.
I've heard with the rationale from advocates on the let's get this thing regulated and get it off the streets. It's dangerous. Is it proliferates like just the undifferentiated, non-specific components express and proliferate cancerous tumorous cells. Like, okay, well, hey, let's stem cells for your shoulder because your shoulder hurts or back pain, whatever. Unknowingly, then they have like underlying cancer that it hadn't detected yet, and then it proliferates that tumorous environment. Yep, that's what I'd heard.
Yeah.
I don't know. What are your thoughts on that?
That's always one of the comments and questions that we get all the time, right? And so although that, is a possibility, right? That's in a perfect world in like a vacuum, right? Our body actually has natural checks and balance systems in it already, right? So it wouldn't be any different than any other proliferative substance. Testosterone, growth hormone, right? Those are things that we use readily sometimes too. So everything again has its pro and a con.
Gotcha.
But the theory on kind of stem cells proliferating a hypothetical precancerous cell that might be floating around in your body, again, your body has such checks and balance systems in it to protect against those types of things. And really stem cells work by finding inflammation. So most of the time, anything that we're going to put in you from a biologics perspective is going to naturally just automatically go to place of inflammation, which generally is, again, most of their kind of work goes into that specific problem area.
Gotcha. I had a conversation with a patient that it was all hypothetical, because they're into this kind of stuff and like, I'm trying to find alternative directions for stuff like cancer or type 1 diabetes or other autoimmune diseases and stuff. Like hypothetically, let's say you had cancer, you found out you're like stage 3, or whatever. What would you do? Would you be like immediate standard understood Western medicine direction of care of like allopathic medicine, chemo, radiation therapy, whatever's appropriate for that, with everything that comes with it? Or would you go the alternative route with it if it's like all the stuff like vitamin compounds, other therapies, and a stem cell direction?
Yeah. I mean, and again, I think it's really just a case by case basis. I mean, I can think of one patient in particular, Susan.
We had her on the podcast here.
Who actually...
Well, me and Roxy.
You and Roxy, yeah.
Yeah. So, I can think of one person. She was a hybrid, right? And so it's very much a case by case basis. There's a very big difference of theory and management style.
Oh, I know who you're talking about.
Yeah.
I know. Okay. Yeah. She was a patient.
Her story was beautiful, but you know what the key in her too is she did her research. And we tell people that like Joe's father just passed away from cancer. And, you know, there's a difference also between the patient wanting to do the research, the family wanting to do the research, the family supporting the research. Susan was very lucky. Her family was very supportive of everything. She dived into everything.
Yeah.
And,
but I think the other main difference too is, you know, there's a difference between a little, you know, squamous cell cancerous lesion on your arm versus pancreatic cancer, right? So it's very much a case by case basis. You know, Western medicine, as much as we're kind of more in the alternative space, you know, there's a time and a place Western medicine is needed.
There's places where chemo works. I mean, it's far and few between.
Yeah. There's instances where you're going to have to go traditional medicine in order to kind of get the situation, hopefully like under control. Yeah. But that doesn't mean you can't be doing adjunctive services or things to help support your immune system or things to help support your body through that traditional treatment.
We've seen both ends. I remember when I first started working for you, there was a lady who came in and she probably could have used some chemo. She had literally cancer, like, right? I mean, I don't want to go into detail, but it was all over her body. It was eating her from
it was breast cancer.
And it probably could have easily been treated, but she came from a family. They didn't do that. Like they wanted, you know, all the holistic. And it was so sad for us to see because it could have been something that could have been helped, and her family like didn't support that.
Yeah. That's a good point. I mean, like, it's not gonna be black or white.
No,
like I'm completely anti either way. It's like, well,
you have to do your research, I think, and be very open-minded.
Yeah.
Especially nowadays.
And medicine is never black or white. That's why we call it the practice of medicine, right? It's very much a moving, floating scale. It's very much a patient by patient basis. And there's so many factors that go into it. So as much as we love to like think about these hypotheticals, it's always so like case by case, you know?
We talk about that all the time because I'm like, you know, chances are one of us are going to get it. And as much as he hates to talk about it, we talk about how like we would be open to anything. And that's how you have to think about it. You have to support each other and be open to any option that there is, and quality of life.
Right, 100%. Yeah, like consider the pros and cons of quality of life.
Yeah.
I mean, I think it's appropriate to have conversations like that, you know, because like if things happen, you know what I mean? Like we're not going to live forever.
No.
And like systemic issues can arise.
Yeah.
Where I'm like, let's say somebody was like, you know, not even considering that, they're shoving it aside, never going to dive into it. And let's say something does happen, then they're like way overwhelmed.
Yeah.
Didn't think this was going to happen.
No, you
like,
can't think that way.
Well, like it might. So if it does, then at least you're not caught off guard too much, right? I've never been there before, fortunately, with anything like significantly severe, of course. So, of course, like I don't have the different perspective of the people. But anyway, I'm always open to like, hey, we got to consider these kind of conversations. You know what I mean? This is important.
It is.
So what about hyper or hypothyroidism? Oh, and then also the next question is
curved thyroid.
Yeah. Yeah, I mean, listen, so we deal a lot with hormonal imbalances, and I think it's important for people to understand that hormones are not just male-female sex hormones. There's two other really important aspects of hormone balancing that's really important. One is your thyroid, one is your adrenal gland. Our thyroid is a really important gland that sits here in our neck, and it really is responsible for controlling the pace at which our body operates. So I talk a lot about the word metabolism, and metabolism doesn't just mean weight, right? Everyone thinks about metabolism as, oh, I'm either going to gain weight or lose weight. No, think about metabolism as the pace at which your body executes functions, right? Us sitting here right now, millions of chemical reactions are happening. And so when I use the word metabolism, think about the pace at which those chemical reactions and those tasks are being executed. So your thyroid regulates the pace, your metabolic rate at which your body can operate. And so as we age, we are more susceptible. As our female and male hormones start to decline, our thyroid hormones also start to decline. And it's probably one of the areas of healthcare that is most mismanaged because we get calls on thyroid stuff, literally dozens of calls a day.
Interesting.
About how, you know, we decide to put someone on a thyroid treatment program, but their primary care doctor is telling them their thyroid is fine. Or the primary care doctor says it should be doing this way, and we think it should be done this way. So it's definitely an area that is kind of mismanaged a lot of times, but it's a very important organ system to make sure that you're looking into and kind of managing appropriately because it affects everything.
Is it a kind of a thing where thyroid dysfunction, metabolic dysfunction can then influence the sex hormones, testosterone, estrogen, or vice versa.
That's
Either way.
100% the case. Yep. So either your thyroid starts to change and it puts more stress on your male or female hormones, or your male and female hormones start to change and that puts stress on your thyroid. There's some crazy statistic, and I don't know it off the top of my head, but ballpark, it's probably 70% of women after menopause will have an underactive thyroid.
I believe it. You know, I believe it. So I would assume then that, like, all right, why does the thyroid get dysfunctional in the first place to then cause a cascade of events to come into play, right? If it's like estrogen or testosterone decline, and then fog, lethargy, other systemic problems. I would imagine before that, it's like all the other stuff we were talking about before with environmental toxins, stress and anxiety, nutritional toxicity, or just chronic inflammatory responses that ends up tipping the scale enough to then have the thyroid get involved, and then like not really noticing a lot of changes, and then like months, weeks, or even years later, then it's like, hey, you have like super low testosterone or super low estrogen. Is that?
That's exactly how it happens. It's exactly how it happens.
It's like a cop-out answer that I've heard from a lot of people is, oh, it's just genetic. Well, it's like, well, of course, everything's some genetic predisposition to be expressed, but I would imagine those triggers then cause those genetic underlying predispositions to be expressed to then cause thyroid dysfunction or metabolic dysfunction.
Totally.
And then the
That's
cascade
exactly right.
goes down.
Yeah. And that's one of the things that we always talk with our patients about is, you know, a lot of people will say, yeah, this is genetic, or I'm genetically, at risk for this. But we know that our nurture, right? The way that we live our life, our lifestyle, our choices can change our nature, can change our genetic predispositions, or not allow our environment and the choices that we make can actually really influence what genes actually express themselves, right? So even though you might be coded to develop this disease at some point, the choices that you make, the lifestyle that you live, how you support your body might actually not allow
mindset.
That
families tend to make the same genetic or the same choices environmentally.
Yeah.
So that might be why it's continuing and circling.
It's like, oh, well, it's genetic. So I love that, as in like there's some ownership and some control that comes into play versus like, well, it's genetic, I'm doomed.
I know a lot of people don't like to hear this, but I think the same is like with obesity. Oh, it's genetic. We have an obese gene. It's like, well, you're eating the same way that your parents did and your grandparents did. Maybe if you made some changes, like we're all a little different. You know, I have one daughter who's skinny like a stick, and I have another one who's she's in her fluffy era.
Yeah.
But you look at the habits too, and you know the lifestyle choices that are made, and you can influence it. Yeah. A little bit, I believe.
I would totally agree. I mean, I staunchly would agree that like obesity, it's like there's a lot of nurturing influence that can dictate that direction. Yeah. And then type 2 diabetes would be in the same boat, right? Because that's completely reversible.
Like, oh, my grandma had it. My mom had it.
So,
well,
you know what? I'm guaranteed to have it when I turn 63.
And that's not a...
What?
No.
Yeah. Anyway, I'm always in the boat of
I just feel like that's the easiest for people to get what we're saying from this. It's the easiest because you can see it versus the things that we deal with. You might not be able to see a thyroid condition. You might not be able to see, but Joe hears it all the time. Yeah. And it's like, oh, it's in my family. What can I do about it?
Yeah. I'm usually, I just, my personality, and when I get exposed to it, I was like, oh, I love that. It's like the Jocko Willink kind of like mentality where it's like, you're in full control of your life. Like you can totally dictate what you want, what you do. You can change your identity, your personality, your persona, your family, like all that stuff. It can dictate a lot of things.
Putting labels and identities on things, you know, I'm susceptible to this. You're already dooming yourself from the beginning.
Totally. Like change that immediately.
Yeah, immediately.
But so another question I have, I know this is a tricky one because it's congenital, underlying genetic predispositions. There's type 1 diabetes. Yeah. Right. So like pediatric, juvenile type 1 diabetes. Yep. What are is it the same kind of thing where it's like they might have these underlying genetic predispositions that will be expressed based off of their exposures? Or is it like at some point it's going to fail when they reach a certain age?
Yeah. And it could be either of those scenarios. You know, we've definitely had, families who come in, very strong family of history of autoimmune disease, and then a child develops type 1 diabetes. or, very strong family history of autoimmune disease. And it's doesn't develop in childhood, but it might actually present at 20s or 30s.
Yeah.
Right. So again, it goes into that kind of how does that individual, that lifestyle then allow that gene expression to actually turn on, or kick on. So it's, type 1 diabetes is one of those things that, again, if you support the body in the right way, you might always have some element of type 1 diabetes, right? So type 1 diabetes is basically where your pancreas is non-functional, right? It doesn't produce enough insulin, or the insulin that it does make is ineffective, right? So we can't.
Caused by.
Generally, so they call it's an autoimmune disease. So whether it's a, kind of just congenital, hey, you're born and your pancreas just never developed properly, or something then caused your pancreas to not work properly.
And cause like an autoimmune type of attack.
Correct. Right.
And dysfunction.
Correct. And that's where some people might present at, 8, 7, 8, 10, 12, and some people don't present until 20s or 30s or 40s. And that's very different. And so our approach always with something like that is, again, just try to identify any underlying contributor. Is it an immune dysfunction? And then just really just support the body as best we can. Manage inflammation, help the metabolic rate, make sure hormones are good. That's generally the approach. Type 1 diabetes, is more difficult to manage, but it's not impossible. People live really long, healthy, productive, successful lives as type 1 diabetics. There's professional athletes that are type 1 diabetics.
Yeah.
Look at Jay Cutler, right? An ex-NFL quarterback, type 1 diabetic. Like, was a professional athlete.
I don't think I knew Jay Cutler. That was a type 1.
Yeah.
Interesting.
Yeah.
What about like stem cell therapy for that?
Yeah, and that's definitely an option. We have treated some type 1 diabetes with some good success, in the sense that we've had patients or type 1 diabetics who've come in, very poorly managed. They're on 200 units of insulin a day. We've actually been able to get people off insulin, but we can't say that obviously their pancreas is working substantially where they don't need some sort of medical management. But we have had some good success in helping to kind of decrease the disease process of type
or the severity.
Yeah.
So I would imagine at that point, it's like just got to live a very purposeful, mindful choice, like lifestyle.
Always.
Understanding of your current situation.
Yep.
I think that's our aim for all of our patients.
It is. Yeah. And the mental piece is always super important.
I think what's interesting too is like, well, before I said this, I was going to say with like lifestyle choices that develop these genetic expressions to then become proliferative. It's like, I don't want to we're not blaming anybody. It's like, what were you thinking? Right. It's like that unknowingly, just things that these maybe things could have triggered these events. So it's not like we're blaming anybody, but I think with like being super mindful lifestyle choices, with like, well, am I ever going to go, like, what can I live normally? It's like, well, who decided that previously, or what these lifestyles is normal?
Yeah.
Where imagine somebody gets bariatric, gastric bypass surgery, and then they lose a ton of weight. And they're like, okay, cool. Now that I lost a bunch of weight, now I can live normally again. And then they gain it all back.
Yeah.
Like, who decided that previous lifestyle was normal? Why not like just reassociate that this is normal, where that's going to be maybe the best recipe for longevity anyway, right?
Yeah.
Where it's like, oh, can't eat hot dogs and hot dog buns, like, well, the buns are like fake bread. It's like, it's not real, like that's not normal. We're like, well, we're really alternatively thinking about how we're making our food. And like, if we're making brownies, like we're using avocados, like it's a mission of like, that's the oil base. And then like there's natural cocoa. It's like, but it's not like real brownies. It's like, well, why not? Like who decided,
Yeah.
Why not make that real? You know what I mean?
It's about changing your habit and making new rituals, and again, like I always say to patients, life is short, you should enjoy. And I never would tell anyone to stop doing any one particular thing. But I think if you can moderate and, 80-20 rule, life is too short to not have a piece of cake or some ice cream.
But if that cake is affecting you over and over and over, maybe you need to dive in and not eat that cake.
Right.
Maybe that's not part of your 20%.
I totally. And also I'd be like,
I
let's
feel
take
like
a step further and investigate where does the desire come from to want to eat the cake?
I've found that I've gotten more that way as I've gotten older. Joe probably thinks I'm turning into a lady, but I'm like, people literally are choosing the way that they feel and they're doing the same habits over and over again. And that's very hard for me as I get older and I've become more aware. It's like, if I can cut these things out, you know, to feel better, it's not so much because you want to do it at first, you know, like when I first started, you know, doing strength training, like it wasn't what I wanted to do.
Yeah.
And now I'm like, I'm addicted to the way I feel.
Yeah.
You know,
I'm going to choose purposefully.
I'm going to choose this. And then that spun off on, you know what, I'm not going to eat this because I'm not going to waste my workout or, you know,
or feel crappy.
And it's funny because you find that people who aren't making those choices, they're like, you're so disciplined, you're so this. And I'm like, I am not. I'm tired of feeling like crap.
Yeah. The pain.
And as you get older,
it gets worse.
I have kids to live for. So,
exactly.
You know,
and recovery processes and everything declines.
It's important.
I think, the times that I've been in a good streak, because it comes in phases, you know what I mean? But it becomes like definitely a habit, you know, and like a lifestyle habit where it's like, oh, it's the norm. Like I work out before lunch or whatever. And then if I don't, then I'm like, I feel guilty, right? But the times that I've been on good momentum streaks, you know, it becomes easier and easier. Yeah. Where it's like, oh, I'm just going to work out real quick. Like I have 45 minutes, perfect. I'll do the bike for 5 minutes and then knock out a 30-minute workout. That's easy. Yeah. Whereas in the past, where it's like I'm not in a good streak of momentum, and it's like, oh, I only have 45 minutes. By the time I get my shoes on, I'll have 40. Then I'm gonna ride the bike. Then I only have like a 10-minute workout. Like I might as well not even do it. You know, it becomes way more challenging to like jump that hurdle. Where it's like, I'll do it real quick, like 10-minute workout. Yeah. It's easy.
It's mindset.
100%. Yeah. It just becomes easier and easier as it goes more and more and more. And then it develops into like a habit. You know?
I think that's one of the most rewarding things I see when Joe sees one of like, I'll pass over a friend or somebody I work out with and he can change how they're physically feeling. And I do think that gives you a little boost. And then it's like they start thinking more positively and like you see this transformation. So I like to think that we have a little part of helping people not only become their best physically, because that's what people think, oh, you're going to do hormones or stem cells and a knee fix or like, you know, your sex drive go up. But like ultimately those things change the whole process of you becoming a more productive person and, you know, just being happier.
Totally. I think, another good point, like it's not easy. Like it's not enjoyable.
No, not in the beginning.
When it's like, I'm tired, like naturally my clinic it's a chilly place. It's cold. And it's
cold in there.
It is. It's freaking, no matter what we do, we can't, it's just, we have no control of the AC. But like, I was like, I'm going to wear a jacket then, problem solved. But it's like, I'm hungry. It's chilly. I'm tired. I'm achy a little bit, you know, it's like, I don't want to work out right now. But I know that I'm going to feel better.
But you're blessed that you're able to work out. There's people out there who can't work out, right?
Right, exactly. And an environment set up for success to be able to like knock it out and make it more, you know, chewable day to day. Yeah. But one thing too, I was going to say that like I came to an epiphany. I think today's Friday, right? I think it was Tuesday night. We get those corn chips from Costco, tortilla chips. You know, love those. I'm a chip guy. I'm also like we talk about this. I'm like a cereal guy. I mean, like just like this oat pumpkin. It's supposed to be organic cereal. I'm like, man, this is good. You know, it's just good with a cool, you know, almond milk in there. Anyway, but I had these chips, and I'm like, I haven't had them in a long time, like a couple weeks probably. Ate a bunch, and I was like, I feel bloated, and I don't feel good. Okay, like. Decision made. Again. I'm not eating them anymore. Like I'm eliminating it from my life. Like I'm just not, they're not good for me. You know, I don't do well with them and I feel crappy right now. I was like, okay, like check mark box, you know, got it. Not having these anymore, you know, dang it. But it's not, I would rather have longevity set up for success than a short term and then feel crappy right afterwards, you know? But that was an epiphany I had like literally 2 days ago. So
I think that's a key indicator that we're growing too.
I would agree.
Those little moments.
Yeah. Totally. Okay, totally. Yeah. So one thing I wanted to do real like before we end was what people can expect when they come in for like what a consult would look like. Yeah. And then like a blood work review, which I had with you guys a couple weeks ago. Yep.
The first thing for us that's important is we need to get to know you. We need to get to know each other, right? So like I can look at a set of blood tests and it can tell me part of the picture, but it doesn't translate into giving me the whole picture. So the very first thing that we do is always like a really in-depth kind of interview, right? Hey, like tell me about you, tell me about your health, tell me about your lifestyle, tell me about your goals, tell me about everything, because that's just as important information for us as the blood tests are. Right. And so we always start with just like a little introductory section where we get to know each other, you know, have a chat, help us get to understand what your short-term goals are, your long-term goals are, what's conducive to your lifestyle, right? Because we don't want to set a program up for you and it's not practical with your lifestyle.
Yeah.
Right. We get people all the time, you know, they're on a plane 2 times a week, or they're traveling here and traveling there, or they have kids, or they can't do this, or they can't do that. So I can't put together a program for that person that's not practical for their lifestyle. They're not going to be consistent. They're not going to be compliant, and we're both not going to have success.
Yeah.
So it's important for us to get to know you, right? Whatever that looks like or feels like.
Yeah.
And y'all do that with a one-on-one consult, right?
Yeah, we sit down, we just schedule a time to chat, whether it's in person, on the phone, on our video platform, doesn't matter how, we just need to get to know each other. Then typically what we'll do is we'll do a comprehensive medical workup, right? So we look at blood markers that are not just traditional medicine markers like cholesterol and blood sugars, but we look at stuff that's a function of your quality of life. We want to look for those early signs of aging. So we want to look at inflammatory markers, macro and micronutrients, hormones, neurotransmitters, because those are the things that start to change at that early age that we can identify early and then put a plan in place to stop them changing or even reverse them changing.
And those are the things that would then later turn into like high glucose and high lipid profile.
Exactly.
Low testosterone, low estrogen.
Exactly. And then
These are markers that people generally have never even had done.
Most people don't, right? They say they go see their primary runs blood work. Their primary runs blood work. That's 1 page long.
Not even.
It's 7 tests. You know, we look at hundreds of different biomarkers and things that are so, you know, kind of outside of the traditional mindset that most primary cares don't even know what the test is.
So what's an inflammatory marker that you'll look at?
So a big one right now is that most people aren't even familiar with is apolipoprotein B. Apolipoprotein B is an inflammatory marker, but it's an inflammatory marker that's a little bit more associated with heart disease. So that's one that, again, nobody probably even really knows what it is. Or if they are having it checked, it's by their cardiologist who probably doesn't know how to manage it appropriately if it even is elevated.
So like when you find that result, now what?
Exactly.
What's the course of action?
And that's a big part of the problem too, is even if traditional medicine looks at something, they don't interpret it the right way. And that's the difference, right? Because for us, our job is optimization.
And you're looking at the whole picture.
Correct, right? People look, or, traditional medicine looks at these reference ranges, right? These intervals, right? And just because something is within the interval, they consider it okay. I don't want to be okay with anything in my life. I want to be as good as I can be. So a lot of times we'll manage someone that's kind of outside that normal reference range.
Gotcha.
And so that's a big difference too.
So apolipoprotein B, what do y'all do for that if it's elevated?
So it is an inflammatory marker, so it responds really well to a lot of natural anti-inflammatories. So we'll do turmeric, curcumin, we'll do glutathione, we'll do some IVs. It is a little bit more sensitive for heart disease, so it becomes important to look at the cholesterol and the lipid markers, look at nutrition.
Is that usually pretty correlated, like the
Yes.
LDL elevated?
Yep.
LDL profile?
Yep.
And then the apolipoprotein B?
Yep.
Interesting.
Yep.
And then, so I mean, the report that I got from you guys was super extensive. I mean, it's 7 pages. Sorry, 14 pages.
Yeah. 7 pages back and front.
Yeah, exactly.
Hundreds of different markers.
Yeah, that's awesome. So what it was with this, my LDL was a little elevated. From what I'm seeing real quick, like that's outside the norm ranges.
Yep.
My sodium was elevated. My SHG, BG, and testosterone total were elevated.
Yep.
And then I think that's it for it there.
You're basically dying.
Yeah, exactly. What is all that? Yeah, what does that represent? So
You were in pretty good shape, actually. So again, you're a very physically active person. So you are a little bit more vulnerable to inflammation just because of the nature of what you do for work and the lifestyle that you live. So sometimes when we see things like electrolyte imbalances, people who are active, they sometimes tend to be dehydrated.
Yeah.
So little things like that, right?
Dehydration for the
sodium, right? Same thing with like your LDL, again, it's not that you eat terribly, but one of the things that we're more susceptible to in activity in particular is your body needs fuel and calories. And sometimes things don't get processed as effectively.
Yeah.
And that sometimes can cause the cholesterol to accumulate. It's not always an intake issue with cholesterol. And I think that's important for people to realize.
Interesting.
There's an inflammatory component. There's a metabolic component, right? And so, those are just a couple of the things that we look at. Hormones is another one. SHBG has to do a lot with male hormone production, female hormone production. So as we get older, we start to see those kind of early shifts take place. And again, not that your results are in a bad place. They're not. They're in a very good place, but there's always little things that we can do to kind of optimize and refine.
You're that patient I was talking about at the beginning. You come in, you're overall healthy, but you want to be optimal. And that's our thing, is optimal is achievable. We have so many people who come in like that. They just want to feel that they want to have that edge.
Also, totally. And they, anything predisposing us for longer, like later in life, like you're good right now, but what we're noticing this.
But let's see what you're prone to later.
Exactly. Yeah.
What are going to be your weak points later?
The AG ratio and bilirubin were also high. What's AG ratio?
So AG ratio is actually a good thing to be high. So that's actually your protein intake. So a high AG ratio tells us that you're getting sufficient protein from the macro side, which is good. Bilirubin is one of those markers that, again, kind of doesn't get tested or managed really effectively. So bilirubin is basically one of our waste products, our cellular waste products. And so sometimes that can be an indicator that your detox pathways are a little sluggish. So when bilirubin accumulates, it sometimes means that your liver or your kidneys are not filtering as effectively as they should be.
Interesting. What would be the course of action for that?
So just better kind of detox kind of concepts. So again, hydration, supplements like N-acetylcysteine or glutathione. Those are great, like liver and kidney detoxifiers.
You need to come in for an IV.
Yeah, you should.
Remember I with the LDL and with, I think we talked about bilirubin, the sodium with the hydration. So like, okay, hydration is gonna be important. Electrolyte balance is gonna be important.
Yep.
And then you were asking me, let's dive into your nutrition. Like, what are you eating? Anyway, we came back to cheese because I have cheese in the morning, my eggs, and then like with lunch I'll have some kind of cheese, and then like at night, or like if I have chips and like some kind of dip or something,
Yep.
But I was like, oh, that makes sense. Maybe I just don't process that as well, and then it accumulates.
So that's a double whammy, cheese. So cheese is very high in producing cholesterol. So it goes back to that LDL number that you were referencing that came back a little abnormal. And the other thing is dairy is always more difficult on our digestive tract to process. And when
especially as you get older.
Especially as you get older. And when you put more stress on your digestive tract, that in turn affects your pancreas, your kidneys, your liver, your filtering organs.
Hence bilirubin maybe accumulates.
Exactly.
Interesting. Yeah. My, that's cool. My iron level was high. But like not by much, but yeah, I thought that was interesting. I have spinach like every day.
Mm-hmm. And that's generally just an intake issue. We generally find that more active people tend to have iron just because, people who are more active, they have to circulate oxygen more. And generally that can cause iron to kind of go up.
Gotcha. Yeah. I thought this was interesting. Testosterone total.
Yep.
From my understanding, the normal ranges is like, I don't know, what, 400 to 1,000.
Mm-hmm.
So I was at 844 and it's saying it's high. Mm-hmm. Why would that?
So for your age, you were kind of on the high side.
Is that naturally?
Yeah.
You're not on anything?
No.
That's like, we don't see that.
It's definitely,
which is interesting is.
How old are you?
36 and a half. So last.
He's doing leg workouts.
It's not skipping leg day. No. I actually just did a BFR leg day yesterday for the first time.
I did that.
Time. That's a double whammy.
Yeah, because we did with you on that.
Yeah, we did that.
Yeah, it sucks. But 2 years ago, no, it was 4 years ago. I had my blood work done with you guys, and my testosterone was like 7 it was like 100 less. It's like 750 or 740.
Yeah.
And then 4 years later, did it again. It's higher.
Yeah.
I attribute that to stress. I was definitely as a proponent at that point in time was.
We see that with a lot of
For sure.
We see so many young guys with their testosterone lower than yours.
Yeah.
Like it's wild.
It's really starting to become a pretty big issue. You know, it's younger guys too. You know, it's just a product of stress and inflammation and high estrogen and pressure. And yeah, it's
Social media comparison games.
for sure.
I'm not a millionaire yet.
Mm-hmm.
I don't have a private jet.
Mm-hmm.
And I also don't have a six pack. Like what I'm occasionally sad.
Yeah.
Yeah.
You know?
It's true. But I mean, in your case in particular, I mean, I wouldn't necessarily consider, so to clarify, the laboratory reference range says it's high. For us, we're going to say that your numbers are optimal. So for you, because of your age, because of your body size, you should be 800 to 1,000.
And
So
you should be very proud of yourself for that testosterone level. We
Well,
don't
thank
see
you.
that very often naturally.
yeah, agreed. So you're in great shape when it comes to that.
I remember I also asked you about the bilirubin with the filtration system, the kidney, liver stuff. You asked me like supplements. What do I take? And I take creatine.
Yep.
Usually I go in cycles of like every day for a period of 10 weeks, 12 weeks maybe. And then I take like a 4 to 6 week break and then get back on it again.
Mm-hmm.
And you were suggesting like, it just could be a lot of dose that you're taking. Maybe back it down to 5 days a week instead of 7 days a week. Maybe these work out or not.
Yeah.
Do you see that with people taking creatine?
Creatine in the last 2-3 years has exponentially grown in popularity. It's one of those supplements that, again, I think it has its potential upside, but I do find that probably for most people, it's more negative than positive. Creatine puts a lot of stress on your kidneys and your liver, hence the bilirubin.
Interesting.
So creatine can be great for muscle building. It can be great for cognition and brain health, but it does put a lot of stress on your kidneys and your liver. I've had younger guys put themselves in acute kidney failure from supplementing creatine too much.
Yeah, Joe's got opinions on creatine.
I do. And I don't want to say that I'm against it because I'm not against it completely, but it definitely has to be dosed appropriately. You have to really hydrate when you're on it. You have to support your kidney and liver detox systems, and you really have to monitor the dosing.
I definitely need to hydrate more. Yeah, dosing. I know the standard recommendation is 5 grams a day.
Very rarely do I ever recommend more than a 5 gram in a 24-hour period.
Interesting. Okay. All right. I've been taking like 8 grams.
Yeah,
It's like
well, but also
four after.
you're a giant human being. So, your dosing is probably going to be a little bit different than my dosing, right?
Yeah.
You got 6 inches on me.
We're a
right.
female.
Right.
Yeah.
Totally.
And then cortisol was one more. I think I fell within the normal range.
Yep. Your
good.
cortisol was reasonably good. You were at 8.6. And so again, the cortisol being that stress response hormone. So generally we like to keep that level less than 8. So if you're at 8.6, I'd say again, as a very busy man, entrepreneur, like that's a good score.
3 kids.
Yeah.
Yeah.
I mean, it's a pretty good score. So yeah, I think you're doing pretty good in that kind of stress response mode.
That's good.
Yeah.
I don't remember what my cortisol was in the previous test, but I remember specifically in that time frame. I think it was the fall of 2021.
Yeah.
I was doing a lot, and had just had a baby. We were pregnant. I was moving into this new space, but I remember I had stress-induced alopecia. So my facial hair was patchy. It was just growing. And I was like, I didn't really understand why. Maybe it was a year after that. But anyway, it was in that time frame.
Yep.
So I don't remember what my cortisol level was at that point, if it correlated, but
I can guarantee you it was higher than where it is on this one. And I can guarantee you it was one of the big contributors to the hair thinning and hair loss. I see it all the time.
It's so funny with men and women. We see they'll come in for like the vanity things. A lot of hair loss, women and men. Like I would say 50-50, if not like, and it's a key into Joe getting in and being like, let's it's not just your hair. Like, let's see what else is going on.
Yeah, right. Someone will come in and they want to talk about stem cell for hair rejuvenation.
Or their skin.
Okay, let's slow down. Let's figure out why the hair is thinning first.
yeah, before you set up for not to be successful anyway.
Correct.
And it's a waste of time and
like,
money.
look at women who just have babies. They get it a lot too. It's probably because it's stress on your body, stress on your mind. You're not sleeping. So
Or huge hormonal dysregulation.
that's a good stress. But imagine people who like you guys are, working nonstop and it's like, you're not sleeping or you're traveling. I think that we have a lot of people that come in for, again, the vanity reasons. And it's like, there is an underlying situation going on.
Yeah.
I think that our outside reflects very much what's going on the inside.
Totally.
And sometimes that's what it takes for people to come in. They're like, oh, my hair's messed up. Now I gotta think about my health.
Yeah, totally. Is there anything else that, like a key indicator that you look for people like on their blood work and stuff? Like common talking points?
Yeah, I mean, again, I see so many different things. There are a lot of kind of consistencies. Ironically, it goes back to this cortisol. Again, everybody
loves the cortisol.
Everybody is stressed or perceives their stress load to be high, or, has this going on or that going on, or I talk a lot about cortisol with people. And again, it's both a physical thing and a mental thing. I think people only think about the mental side of cortisol, but it can also be physical, right? An athlete, a CrossFitter, you get into a car accident, or physiological. So like vitamin deficiencies or hormonal dysregulation, that creates a physiological stress response within our body.
Yeah.
So even if people are like on cloud nine, no stress in their life whatsoever, they can still have high cortisol because of the physical or the physiological reasons.
Yeah. Interesting.
So that's a big one for us, for sure. Yeah. We deal a lot with hormone dysregulation as well. Male, female, thyroid, adrenals. Those are probably two of the more common things that we see in most of our patients.
Yeah.
Interesting.
A lot of no sleep, a lot of hair loss, a lot of just...
Yeah, sleep and hair loss are big ones.
Yeah.
Fertility issues.
Oh, gosh.
Especially now post-COVID.
Interesting.
A lot of fertility.
A lot of long
problems.
COVID problems. I mean, even me, I've got markers that like we've never seen since I've gotten COVID.
Interesting.
It's just interesting.
What correlates?
Autoimmune. Well, again, it goes into Joe saying everybody has their
thing.
Their thing that comes out, and mine is autoimmune conditions that we've always known are kind of like a little bit there, but
it spiked with the long COVID or just previous COVID issues.
Just previous COVID.
And other than me, we see it so much, children, adults, but fertility is a big one. So many. And so many people don't talk about it. They don't see it. But we see it all the time. And young people too.
Wow. That's interesting.
Yeah.
What do y'all do for fertility?
Same thing. We got to dive in.
Yeah.
You got to dive into the male component and the female component.
Is it a problem getting pregnant? Is it a problem staying pregnant? Is it like what's going on? And you have to look at both people, because it's not just
it's two extremes.
It's not just the woman. It's both. And sometimes, just depends.
Yeah. Interesting.
Yeah. Wow. Obviously a lot of hormonal, but also a lot of inflammatory, micronutrients, a lot of different things on both the male and the female side.
I would imagine the same kind of directional changes or an investigation, like environmental things, nutritional, stress, all that stuff. And then a cascade of events lead down the road.
Yeah.
Interesting. Well, thanks you guys for coming in.
Yeah.
Super insightful. And I hope a lot of people got some good information from this. What would y'all want to let people know, like about you guys, and then when to call?
Ultimately I would just say, again, if you feel in your gut that something is wrong or something is not right, or you're just not feeling as optimal as you should, and you're just not getting anywhere, reach out, because chances are there is something and your intuition is right. There is some component of something biologically going on that is not well. And come in and just have a chat with us. Again, you don't have to be in South Florida. We have patients in 40 states and 10 countries. So a lot of what we do can be done remotely. But just, if you don't feel right, if you're tired of feeling tired, if you're not getting the answers that you want.
It's not in your head.
It's not in your head. We're smart. We're intuitive species.
And there's so much good knowledge coming out. That's what we're so excited about. There's so many people who are now not accepting just feeling average. Like there's so much light on what we're doing, and it's beautiful and it's promising.
It is. Yeah. And again, just know that, we're going to treat you individually, right? We're not a one size fits all shop. Every situation and experience and lifestyle is unique, and you have to be treated that way. So that's where traditional medicine doesn't do a really effective job. Yeah. And so that's where we're really different, and where we have the ability to really help a lot of people.
Yeah.
Cool. What's the best way for people to reach out?
They can call our office at 561-331-2983, or they can reach out on our website, and there's a little icon, it pops up, and it's like, how can we help you?
The little chat bot.
Yep. And that's www.r3health.co. Co, right?
C-O.
Yeah, C-O.
Yeah. R3health.co. Mm-hmm. Cool. Well, thanks again for coming in, and we'll have to get another round of, of other stuff we can just talk all day about, you know, because we're nerds on these health things. So it's just cool. Yeah. And if y'all have any questions, like or comments, questions, concerns, conflicting opinions, like we're always open to ideas. And if you have any issues that you feel like we could help, we'd love to help. Feel free to reach out to us. We can at least talk on the phone and maybe get an idea of where we should send you and refer out to our networking people like them at R3 Health. So if you have any questions, don't hesitate to reach out, and we'll catch y'all next time.